Hi, my name is Shelby Sauce. I work for iHeartRadio here in the DMV area. I am a Pilates princess, I'd say, but I'm also pretty funny. I do stand-up comedy on the side for charity. I'm pretty active, hanging out with my friends and family and prancing around Arlington, I guess.
Hi, I'm Dr. Andrew Kochuba, board-certified plastic surgeon here at the Austin-Weston Center. I am specifically trained in aesthetic plastic surgery in the face, body, and breast. I've been in practice now for almost 6 years after all my training and fellowship. I work at the Austin-Weston Center. We're a freestanding office and surgery center specifically tailored around aesthetic or cosmetic plastic surgery. Working here for now, soon to be my 4th year, and you're gonna sort of follow us along for our journey and hear about her story.
So what originally made you start thinking about breast surgery?
When I was 21, around that time, I started losing weight because I had gained a lot of weight in college. I am 4'11", and so it showed a lot more as well, which was lovely. And I ended up losing about 45 pounds. So obviously, the girls just were the first thing to go. I was already insecure about it, but I thought in the summer it's okay because it's just summer is not that long. But then when I got into radio and I also started posting myself more online, the first thing people would make fun of was my cleavage. It got to the point that I'm not getting any younger. I want to treat myself. I deserve it. So yeah, I decided to come to Austin-Weston, Dr. Kochuba.
You know, you feel like it's just not, you're achieving where you want to be.
Yeah.
Sounds like people specifically pointed out to you, which is even about the worst of the worst.
Yeah.
But you're like, this is a me moment, and this really is a me moment.
Yeah, Dr. Kochuba made me feel very comfortable and not rushed. And I have gotten, consults in the past. These places always made me feel really rushed, would look at their watch or just didn't really answer my questions. I always just call it like their go-to speech. It's kind of like their sales pitch, but it's so generic, and you didn't do that. You actually sat with me, you didn't look at your watch at all, and it was snowing outside. And I was like, oh man, everybody's trying to get out of here and I'm probably the last one here today. And he didn't look at his watch at all, and I was like, okay, cool. But also you actually walked me through a lot of stuff. You told me different types of ideas that you had. And then also I just felt very comfortable, and it didn't seem sales pitchy. I've had doctors in the past where I just felt like we didn't have a relationship at all, and it always felt really awkward. And then I was worried that I couldn't reach out to them, whereas I think I could DM him on Instagram. I feel like we have a really good relationship, and then I don't get worried about anything, and then I can just be myself and be honest.
I had surgery when I was younger. That's half the reason. If you look at our website, my CV of why I got into plastic surgery, and that process, having someone there for you is a huge difference. For anyone that I operated on, sure, she's DMing me, she's messaging me, but all patients, they get my cell phone. If they want to text me, they want to call me. Obviously, there's always someone on call for the practice, but a lot of this is your nerves are spiraling. You're like, oh my God, did I do this or that? If I'm able to alleviate that concern and it lets you, further along your healing process, hey, I'm glad to help. So she had bilateral breast augmentation with Allergan 265cc high profile silicone implants. They were underneath the muscle, dual plane, so half under, half underneath the breast tissue. She had a lollipop or circumvertical mastopexy or breast lift, and then she had liposuction of the armpits or the axilla to really give her that pretty breast silhouette and shape that she's trying to achieve and got. So as she continues to heal, she's even going to get a better result, and it's going to look even more like her as time passes.
The first moment you saw your results, how did you feel?
I was really happy because even though I felt very confident in, everything that Dr. Kochuba and I had talked about, it still is nerve-wracking. I was honestly really worried to look at them. I was elated because everything it looked really great. And it's the first time in my life I've had just, boobs that look normal, I guess you'd say. The amount of boob tape I had to lift my old ones up, I would always have to finagle all these things just to make something work. And there's this top that I wore last weekend that I literally could just put on and walk out. And I'm like, I didn't take an extra like 5-10 minutes just to try to figure out what's gonna work with the top when like, which was lovely. I'm very single, so I like don't know the next time somebody's gonna see me naked that I'm not gonna be insecure about that, because that like I never wanted to take a bra off because I was very insecure about that. So yeah, it's just like it's nice to have confidence. I just feel like I worked so hard to get to this like healthy part of my life that now that I have this done, I just feel like a new woman, and I'm in my 30s, so it's cool because I feel so confident and hot. So I'm like, yeah, let's go. I love it. I love being in my 30s.
She was really concerned about pain medications, and she said like, I didn't know what the recovery is going to be like. I didn't know compared to other friends that had it. The fact that we did like a fast track recovery, breast augmentation, the fact that we did narcotic or opiate minimizing, as well as we used the fancy medication that's called Exparel. It's an injectable slow release Marcaine. All these within a day. Like she said, she came the next day. You really didn't need the strong pain medication. You were just taking maybe some muscle relaxant, Tylenol, and Motrin. It's usually all you have to need.
Yeah.
Secondly, just how quick they bounce back. Within a week, they're driving themselves to their appointment.
Yeah.
They're probably not even taking anything, even though they're saying I'm a little bit sore, and they're feeling so well, they're trying to get back to the normal routine. For me, everything goes smoothly, and that's a normal recovery.
I like that everything was right here and you didn't have to go somewhere else. And I really feel like everyone here just makes sure everyone feels comfortable no matter what, and make sure that they figure out what's best for you. When I come here, it feels like I'm just seeing my friends again, and I really like it.
I think really having a center that just focuses on plastic surgery, but aesthetic plastic surgery is huge. And the amount of quality of surgeons that are here, the experience that's here, it's almost second to none. And, you know, having someone that if I have an idea, I want to bounce a question or have something in surgery that's outside the norm, and if I didn't feel comfortable, there are 4 other board certified plastic surgeons here with combined over 100 years of experience, from consultation to preoperative to your surgery to all your postoperative care. Everything's done on site, and then we have our own med spa. So injectables, esthetician treatments, it's all done here.
I feel like you guys just make it feel like such like a personal experience for every single person, instead of just like you're checking a box, you're just a patient, whereas like here it does not give that vibe, which I love. If you want something to give you a little if you are feeling not as confident as you think you would, I'd say just go for it, because it's your body. You can do what you want, and obviously if it's a little bit too much, whatever you want, the right doctor will tell you that, which he will. I definitely think you should just go for it. I mean, yes, am I insecure about stuff? Absolutely. But I definitely feel like this is the box that I need to check just to not have to be so hard on myself anymore. I do feel like getting my lift, my implants and everything, it's just made me so much more confident, and I don't feel like there's now anything else I need to do, if that makes sense.
To me, her recovery was extremely straightforward. It was about as easy to come. If you enjoyed learning more about me, Dr. Andrew Kochuba here at the Austin-Weston Center, you enjoyed learning from Shelby, I would say come see me for a consultation and learn more about how I can help you. This is the best way to try to build a relationship through video, but have an idea of what I am like as a person, as well as what I would be like if I were your plastic surgeon.